Hi, thanks for your interest in ChiroThin. I want to tell you more about it and what you could expect if you decide to embark on this weight loss journey. ChiroThin was developed by a chiropractor about 15 years ago, and he has since basically marketed it to, and it's been distributed by chiropractors around the country, hence the name ChiroThin. But what it is a completely natural weight loss, fat burning, metabolic stimulating supplement that you take along with very specific dietary changes. And for the 6-week weight loss losing phase of the program, you will be expected to lose anywhere from 20 pounds up to as much as 35 pounds. If you have a significant amount of weight to lose, I have actually had people lose as much as 45 pounds in 6 weeks. This is perfectly safe because it is obviously very closely monitored by myself and my practitioners, but also because you're eating real food and because you're not starving yourself, you will maintain all of your muscle and only lose fat. The reason this is important is because at the end of the journey, you will actually have a better metabolism than where you started. Your metabolism really relies on how much muscle you have, not on really anything else like age or other factors. So obviously there's lots of people around the country in the last few years who have been using the weight loss drugs from the medical profession that are really diabetic drugs, right? The GLP-1 type drugs. But the reason that they're not successful always in long-term weight loss maintenance is because they also lose a lot of muscle tone while they're going through this weight loss journey. So although they might lose a significant amount of weight, they're actually not maintaining their muscle. So when they stop the medication or alter their diet in any way, they actually find that the weight comes back just as much, if not more, than where they started in the first place. Obviously, that's not what we're looking for. I'm looking for a natural approach that's safe, very effective, and is a long-term sustainable option. Obviously, we talk a lot about diet here in our office because that is what we're focused on. But even with a healthy diet, because of stress, because of the different toxins that we come into exposure with in the community all the time, in the environment, and then also because of our body's storage of fat and resistance to fat loss, this program is very effective at getting things moving, getting your metabolism back on track, and helping you to lose a significant amount of weight in a short amount of time. So the reason I love it is because everyone that has done this program, including myself, my husband, and many family members, have lost over 20 pounds, sometimes more, and have kept it off for greater than a year. So I know that it works. With the right approach and a standard approach, you will get results. People that go through this program often report a greatly improved health, as you might imagine. So I've seen them reduce inflammation in a significant way, get rid of pain and chronic joint issues, swelling that they were experiencing that wouldn't go away, and then seeing the lab numbers improve as well. So watching their A1C or their measure of long-term glucose in the blood come down, cholesterol levels normalizing, thyroid's working better, things like that. So I've seen the proof, it's in the pudding. It's existed for a long time, and we've only introduced it into our office after trial and finding out for sure that it does work and it is a long-term sustainable improvement in someone's health. The way it works is you take a specific proprietary blend called ChiroThin, it's a liquid, and you take it 3 times a day for 42 days in a very specific way. This is all outlined, of course, in our program guidelines. And you take that in order to suppress appetite, stimulate fat burning, and also to have a mild detoxifying effect on the body. At the same time, you eat 2 meals a day, lunch and dinner. That is 4 ounces of lean protein, 4 ounces of specific ChiroThin approved vegetables, and 4 ounces of ChiroThin approved fruit. You also have access to a long list of what we call free vegetables, which would be extra things you can add into your diet that would include things like cucumbers, tomatoes, lettuce, etc. So no one feels hungry on this program. Everyone feels satisfied, and sometimes they actually feel like it's too much food to eat because of the appetite suppressing capabilities of the ChiroThin formulation. The weight is measured daily, and it is monitored daily through our online portal by your practitioner. So what we do is we actually look at what you're eating, how you're losing, whether you're getting enough water, and we monitor you every single day throughout the 42-day program. By doing this, we can head off any problems at the past. If your weight loss stalls or slows, we can help you to get it going again. By doing this, we find great success, and as I said, everyone that's gone through this program loses 20 pounds or more during the 6-week losing phase. If this feels like something that could be a good fit for you, and you want to do this by yourself or with a spouse or a friend, please let us know and we'll be happy to help you get more information about how to get started.